Welcome back, everybody. In today's episode of Drug Talk, I want to go over 3 things you should probably be aware of before using Chlordiazepoxide or Librium. Number 1, there is a precaution associated with Librium regarding the performance of hazardous tasks. One of the common side effects caused by Librium is known as somnolence. Somnolence is a state of drowsiness or a strong desire to fall asleep. Because of the side effect, it's important not to do things like drive an automobile or operate heavy machinery just after your first couple doses of Librium. It's best to hold off on these activities until you have a good idea of how Librium makes you feel after a dose with respect to drowsiness. Another reason to be cautious is because Librium is known to potentially affect a patient's mental alertness. It should be noted that these effects that we're discussing would be more severe if Librium was used with alcohol or CNS depressants. Usually the feeling of somnolence throughout the day would subside after time of using Librium as your body gets used to the medication, but if this side effect seems to stick around for a while, it may be worth having a conversation with your prescriber. They may choose to switch to a new medication or alter your current dose of Librium. Just be sure to keep your prescriber informed before making any decisions with regard to how you're taking your Librium, because these decisions should really be made by the prescriber. Number 2, when you start taking Librium, you could be at a risk of experiencing psychiatric side effects. Some patients have experienced things like excitement, stimulation, acute rage, and hyperactive aggression. The aggression was more commonly seen in pediatric patients. We must also be cautious when using this medication to treat anxiety in patients who sometimes show signs of depression because of the increase in suicidal tendencies. So follow-up appointments with your healthcare team and your prescriber are important to monitor for these types of side effects and symptoms. It could be helpful to keep a mood journal to journal down how you're feeling from day to day with regard to your mood, so you can show up to appointments with your prescriber with concrete information of how you've been feeling day to day since starting this medication. This will help your prescriber make an informed decision of how to best move forward with your care. And number 3, although rare, Librium can sometimes decrease liver function. Nausea and loss of appetite are 2 symptoms of decreased liver function. So if you experience these symptoms and they seem to linger for a while, it's worth mentioning to your prescriber. They may choose to order blood work to check on your liver function. Nausea is also a general side effect of Librium, so just because you experience nausea, that doesn't necessarily mean that your liver function is compromised. It should really be more of a concern if the nausea doesn't go away after some time of using the medication. You can expect to have regular blood work done at annual appointments while using Librium. That's all we're going to talk about today with Librium or Chlordiazepoxide. But before you take off, I wanted to let you know you can pick up a copy of my book, the 5th episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.